Under the leadership of President and CEO Curtis Barnett, Arkansas Blue Cross Blue Shield is advancing a comprehensive approach to address food insecurity in communities across Arkansas, including providing critical funding to help organizations supporting communities impacted by the COVID-19 pandemic. To hear more about these efforts, we are now joined by Rebecca Pittillo, Associate Director at Blue and You Foundation for a Healthier Arkansas. Rebecca?
Hi, and good afternoon to everyone. We're going to start with, get these slides going, with kind of a history and just about Arkansas in general where food insecurity is concerned. 1 in 5 Arkansans struggle with hunger. Many of them don't know where their next meal is going to come from. Arkansas ranks in the category of very low food insecurity at 8.1%. So to give you an idea of what that means, households that fall into this USDA category had more severe problems experiencing deeper hunger and cutting back or skipping meals on a more frequent basis with both adults and children. Arkansas ranks second in the number of people facing food insecurity, according to a more recent report, 19.7%. Arkansas is ranked 6th in senior hunger nationally. An estimated 240,000 plus Arkansans over the age of 60 are food insecure. And again, this is on a good day. This is before COVID-19. So committed to the cause. For more than 7 decades now, Arkansas Blue Cross Blue Shield has been committed to truly providing a peace of mind to our members through the obvious nature of our business, but we've also invested in our communities to try to improve the overall health of our state's citizens. There are many factors that combine to affect the health of individuals in the communities that we serve. There is an increased recognition of the influence social determinants have on a person's overall health, economic stability, neighborhoods that people live in, and their physical environment, their education, communities, and of course food or the lack thereof. So we're looking beyond just the place where medical services are provided in an effort to positively impact health early on. In the past few years, we have made a concerted effort to work with organizations in the state that are committed to helping people have access to nutritious food. Feeding the most vulnerable Arkansans help give them a step toward better health and a better life. In 2018, in celebration of our 70th anniversary, we worked with community organizations, businesses, churches, and schools to prepare more than 1.1 million meals for local food pantries through our Fearless Food Fight. In early 2020, we were approximately 20,000 meals away from surpassing our 20 million meal mark. So quite an accomplishment. In support of our corporate commitment to good nutrition, our Blue and You Foundation for a Healthier Arkansas also has supported programs statewide that have begun to help bend the trend on hunger in the state. Over the last 19 years, we've awarded 242 grants to help fight the battle of food insecurity in our state. These grants total more than $2.4 million and support food pantries, cooking and shopping, educational programs, community gardens, backpack programs for schools, and after-school programs, summer nutrition for children, and daily lunch programs and soup kitchens. So that was all before COVID-19. So enter novel coronavirus. America and Arkansas are in shock at the sudden need for social distancing. Fear began to get a grip on our nation and the world, and our state was no exception. We've all seen the photos and the footage of flights fights over bathroom tissue and the disappearance of thermometers and bottled water from the shelves and all the hoarding of antibacterial hand gel. Well, our food banks in Arkansas anticipated and began preparations for the worst situation possible. They began to order additional food from their usual resources, look for new resources, and stock up on proteins with more shelf life. They were making decisions, like all organizations, about how to serve their patrons while keeping paid staff, volunteers, and their patrons safe. We reached out to state leaders in the food insecurity space, already partners in the fight against hunger, to assess the needs. And this is what we heard from some of our partners. The Arkansas Hunger Relief Alliance was already helping with most every aspect of feeding the hungry in our state. With heightened needs to protect people through social distancing, of course a practice needed to reduce the spread of COVID-19, but also a practice that pushes people further from the food sources needed. So issues there. The Arkansas Food Bank, working closely with Feeding America, the Arkansas Department of Health, the local school districts in 33 counties in central and southern Arkansas were sending thousands of emergency boxes to schools for kids to pick up, trying to ensure children, families, and seniors have access to the most basic necessities during this time. As in the case in many states, sometimes the only meals a child will get in any given day is through the schools. The food bank drew on 3 months of funding to get ahead of the impending demand. The Pack Shack was seeing an escalating number of requests from an already demanding list of food pantries, and new groups were starting to surface: out-of-work musicians and furloughed restaurants and hospitality industry workers. And so since the process used to get meals packed at the Pack Shack involves lots of people working elbow to elbow in large spaces, the volunteer-driven method of meal packing had to be re-engineered. The bottom line is everyone needed funding, and they needed it immediately. Already existing gaps were getting wider, and the sense of urgency was real. We recognize the tremendous needs created by COVID-19 and understood the importance of responding with great urgency. To support food insecurity, the Blue and You Foundation for a Healthier Arkansas gave $500,000 throughout the state by donating to the 3 large food distribution hubs that I previously mentioned: the Arkansas Food Bank, the Hunger Relief Alliance, and the Pack Shack, as well as the 17 United Ways of Arkansas, who will all provide food to thousands of Arkansans. We also understand that there are organizations who can help fill in the gaps that we might miss, and so we also provided $150,000 to the Arkansas Community Foundation that currently has a grant process open to nonprofits with food insecurity being a focus. COVID-19 called for an urgent focus on how we approached our traditional grant season at the Blue and You Foundation for a Healthier Arkansas. We suspended our normal grants that are open for applications in a normal year, January through July 15th, and we opened the Rapid Response COVID-19 Relief Grant Program. We've earmarked $1.7 million in grants supporting nonprofit organizations that have been impacted by and are making the greatest impact on preventing the spread of COVID-19. The grants range from $5,000 to $150,000, are truly a rapid response in that we have been evaluating and awarding on a weekly basis, and the grant process is more simple than it's ever been to apply. The first week we had 52 grant applications come in. The second brought in 107, and the third we had an additional 55 grants come in. So the need is just, it's overwhelming. I make mention of these grants to also say that it was very telling to us the importance of our initial gift to food insecurity, because many of the organizations that we were seeing coming in with these grant applications, they didn't have a primary or even secondary mission to feed people, but they were asking for funding for food. When we made follow-up calls to the food hubs, it was evident that this was a long-term issue. To save a little time, I'll just share with you the report that we got back from the Arkansas Food Bank. Since our gift to the Arkansas Food Bank, they have seen a dramatic increase in need, along with a complete shift in how they can best serve those in need. The need to help first-time users of the charitable food system is one of the shifts. They report that around 40% of their distributions are to new users. The sudden loss of employment and unemployment system being overwhelmed has left many stranded without income and without unemployment support. These are families and individuals who have never been forced to use the charitable system before and have no idea even the questions to ask or what to expect. The second shift is, in order to support social distancing, they've had to flip their model from a hand-on grocery store model to a drive-through and pickup model with very little contact with clients. This has created a need for boxes and box packers, both of which require additional resources. They report that having the support of the community helps meet those new demands and new models. From the beginning of the pandemic in early March, the single focus has been to meet the needs of Arkansans no matter the change or the cost that it required. To date, the funds from organizations like Blue and You Foundation have allowed them to pack and distribute over 18,000 emergency boxes and distribute an additional 2 million pounds of food. I'd like to share with you this very touching statement from the Arkansas Food Bank CEO, Rhonda Sanders. She said that there are so many faces that stand out when I consider our work the past 2 months. One in particular always inspires me. In North Little Rock, we had a direct distribution using the drive-through model. We only set aside a few boxes for those who live close by the neighborhood and did not have a car. We were down to the very end of the distribution, and there were only a few boxes left for cars and only one left for walk-ups. An elderly lady walked up the sidewalk looking to see if she could get food. I took one of the last boxes and sat it on the ground where she could pick it up and maintain the adequate amount of distance from me. She began to cry and said, "You have no idea what this means to me." Rhonda Sanders continues, "I may not be able to completely walk in her shoes, but I can safely say that she also has no idea what it means to me to be able to provide her with a box full of food and of hope." Again, that's Rhonda Sanders, CEO of the Arkansas Food Bank. So evaluating needs and next steps. We all recognize that COVID-19 has caused as great of an economic impact on our state of Arkansas as it has on health. But as the state of Arkansas begins phase 1 of reopening, we're hopeful that those who were furloughed from their jobs and experienced job loss will get back to work in safe environments. But we also brace ourselves for the possibility of what comes next and what needs will arise. Because of this, we are continuing to evaluate needs as the grants come in and look to what our next steps will be to help Arkansans with what will surely be a long-term rebound from COVID-19. So I, too, would like to end on what I feel like is a very positive note, staying the course. Arkansas Blue Cross and Blue Shield has such an amazing team of employees, a little over 3,000 strong. We always say when a need surfaces, they are the first to raise their hands to help volunteer and the first to reach deep in their pockets to support their fellow Arkansans. They are compassionate, committed, and generous. Every year they participate in the annual charitable giving campaign to support charities that address social determinants of health, including food insecurity. In 2019, they pledged more than $93,000 to organizations in our state, which was matched by the company. On average, they support more than 35 worthy causes and raise about $50,000 annually for various charities above the giving campaign that I just mentioned. Arkansas Blue Cross and Blue Shield employees hold food drives throughout the year, including the summer cereal drive, which collects hundreds of boxes that are donated to food banks to support kids throughout the state. Since March, more than 2,500 of our employees have been working remotely. COVID-19 has created its challenges, but their spirit is strong, and they are taking care of our members and serving individually in their communities, sewing masks, packing food boxes, packing hygiene kits in their homes, of course gowned and masked and wearing their gloves. The foundation is continuing to review grant applications and meeting those needs in the community and in the state. The company is continuing to respond to other needs in our communities. Arkansas is our community, and as with any community, it takes everyone working together to make us better and improve the lives of our neighbors in the communities where they live, learn, work, and play before, during, and after COVID-19. So thank you so much. I appreciate the time to present on this very important topic.